now. It's going.
Okay. From what I found, free healthcare services for the entire country would improve health regardless of any factors like race, etc. When you get free healthcare from birth, it leads to a longer life and potentially reduce societal inequality. People would no longer go bankrupt due to medical fees. The government would regulate costs, so there would be no competition between healthcare company or insurance companies. Create an overall healthier population. With the overall healthier population, hospitals wouldn't get overcrowded, and everyone would get the treatment they needed from the hospitals. Universal healthcare would lower costs of the national economy because the government would control the prices for medications/services. Doctors and hospitals would no longer target or prioritize wealthier clients, making sure everyone gets the same level of care. I found that there was in countries that would do it different ways from the ones that do provide free healthcare. One way is the societalized medicine, which all hospitals would be owned by the government and doctors and nurses would be government employees. The United Kingdom uses this health service. This service has proved to be a more cost-effective way, though. The second way is a single payer system, which Canada does, and the government provides healthcare for everyone, but doctors, offices, and hospitals are still private businesses or nonprofits. This system allows for more of a choice between doctors, offices, and hospitals with different types of care. And the third way is private insurance. This allows private insurance companies to regulate and mandate everyone purchase some type of healthcare plan. There was a study that researchers did at the Harvard Medical School and Cambridge Alliance in 2009. They determined that 45,000 Americans die each year to problems related to their lack of health insurance. These deaths could be easily avoided if everyone was covered. This data that was analyzed from national surveys carried out by the CDC. They also found that there is a 40% increased risk of death if you're uninsured. And that's all I have.
I found a couple main points to be pro universal healthcare. The first one was that there's major racial disparities in private healthcare. A study done by M. Holtkamp that was published in 2018 used data from TRICARE, which is a US government-sponsored healthcare that's essentially a universal healthcare system where everyone has access to the same benefits. So data collected from that TRICARE system showed that universal healthcare would likely have the benefit of decreasing or eliminating racial disparities in healthcare so that everyone has equal access to equal care. And then better access to healthcare for everyone means less discrimination based on social factors. The second main issue is the mortality rate associated with being uninsured. A study published in the American Journal of Public Health in 2009 was trying to find updated data about mortality rates, and they found that over 40,000 people die in association with the lack of health care. So having a standard universal health care would help people seek care for extreme illnesses that otherwise they couldn't seek treatment for because of high cost. And thirdly, productivity becomes a huge issue. There's a deficit in the economy when people are sick and can't go to work. So if people have access to healthcare, then they can get treatment for their illnesses. A study found that workers with health insurance miss an average of 4.7 fewer work days per year than employees without health insurance. So people who have some form of health insurance are able to seek care for short-term and long-term illnesses and are able to manage those symptoms and miss less work.
Okay.
And
yeah, so I might just, it's like kind of a rebuttal, but like not really. It's just like, it kind of goes off of what I'm going to talk about later, which was like the summary of what I found. I didn't really find a lot of articles that were saying that our healthcare system should stay the exact same right now. Like none of them that were actually like backed by research really. So then I was like, okay, what else can I do? So I found a lot of articles that were more geared towards like not free healthcare, but like more like a little bit more regulation. So it's kind of like what you guys were saying about having there's discrimination between that kind of stuff, and like sometimes it's just like really expensive. So if there's more like regulation within like I guess like pharmaceuticals probably would be a big one. It could have the same benefits without making it completely free, which would be a very difficult process, like a long process as well.
Okay.
So I guess what I would add is, so like universal healthcare, obviously it's good for everyone who can afford healthcare. But if you can afford healthcare, then like, I guess how do we pay for universal healthcare? Like we'd have to increase taxes or something like that, right? Kind of, that's one of the things I'm going to be talking about later. And you're essentially going to be paying for other people's treatments and other people's problems.
Okay. Do you guys have any like comments on our our comments?
I mean, no, not yet. I just want to hear what you guys have to say first, and then
Okay.
I'll probably.
Yeah. Okay, so I can read my summary. Okay, so the first empirical report that I found was made up of data gathered from like previous studies that examined insurance plans and like different net cost savings and high costs within those plans. And the authors had consulted like 10 single payer insurance experts, which I think you mentioned single payer. And there's like a checklist flowchart within that article with 18 studies and 22 plans that kind of talk about like both quantitative and qualitative ideas. They did exclude not-for-profit government agencies, but they did include undocumented immigrants. And based on the research they gathered, the researchers stated that rather than working to find a way to provide free healthcare for all while minimizing the difficulties and fraud that can potentially come from this big change, the government would be able to provide savings for Americans if they negotiated for lowering the price of drugs within the pre-existing Medicare program. The second report is an article where all the data collected is also from previous studies and reports. And this one actually includes like worldwide. And they did it to consider countries that have implemented universal health care. Let's see. Oh, this article specifically references the index provided by the World Health Organization and the World Bank to compare universal health care between countries. The issue brought up, however, is that this index provided, which there's a lot of references to emphasize the effectiveness of free healthcare, is actually pretty skewed because there's 16 indicators in the index to measure effectiveness, which is actually a really small number when compared to the 129 countries it's being used for that actually fit within that index. And differences between these developed and developing countries cause contrasting relevancies within each, which then brings up the question of whether or not information regarding the success of free healthcare in other countries is just because of the data being skewed. The third article is from the American Heart Association, and it's based on the principles developed by the American Heart Association. They proposed a new principle that all people living in the United States should have guaranteed access to evidence-based preventative services with minimal or no cost sharing, regardless of how they gain coverage. So at first look, it seems that they're kind of in support of providing free health insurance for all. But I think a big part of that principle that I talked about is that it emphasizes minimal for only evidence-based preventative procedures or services. This kind of like backs the argument that the United States should not be providing free healthcare insurance for all, as it's coming from the American Heart Association. Yes, that's all I have.
Okay.
Okay, so one of the biggest concerns with universal healthcare is again, how we pay for it. And I found an article online that did a study that predicted how much we would have to raise taxes and how much it would cost in total compared with how other countries do it that have universal health care. And the study was conducted on October 30th in 2020, and it basically says that general taxes would need to be raised by about 7.5%, and income taxes would need to be raised by 4% in order to begin coverage for it. And not only that, but like even if we did raise taxes by that much, the study also says we would still be in debt by about $10 trillion after 10 years. So basically taxes need to be doubled from what they currently are to support universal health care in America. My next biggest concern is the overall degradation in healthcare. So universal healthcare for everyone is a huge jump from what we currently have with healthcare in America. And I don't think there are enough doctors to see everyone in the US who has medical problems right now, which could lead to a huge work overload on doctors we currently have. And it could even cause people to not want to become doctors in the future due to the amount of stress they have to endure for this. But even the doctors we currently have, or if people still do it, the doctors will be overloaded with work, and this can lead to them causing or not examining patients correctly and lead to incorrect results, not getting them the proper health care that they actually need. That just waste both their time and the patient's time. And I guess my third point is that wait times to see a doctor. So according to another study I found in on healthcare in Canada, the average wait time to see a doctor in Canada is about 3 to 4 weeks to like see a doctor initially. That's not like an examination or anything at that point, it's just to see them. Then so the United States has a population almost 10 times that of Canada, and the wait time in Canada is 3 to 4 weeks. So the wait time would be almost 3 months according to the study, which is insane if you're like actually having a big issue or big medical issue. And that's what I got.
What you were saying about earlier about what your rebuttal was about paying for other people's, basically paying for other people's at the same time, spending yours. I mean, the only thing I would say is to look on the brighter side of that. And yeah, other people might be paying for yours, or you might be paying for other people's, but other people are paying for yours at the same time. So kind of, I would say evens out.
And I guess my rebuttal for that would be, what if you don't need healthcare?
I guess mine would be, who doesn't need healthcare? I mean, who doesn't need to get seen by a doctor or some other type of medical professional? I mean, think of all the health related problems there are. It's not just, oh, like what if you just broke your hand, or like, or it's not all like these high up medical problems like cancer or something like that. What if you just broke your hand, or something like that? So
That's true.
Also, we already share lots of costs for things through taxes. We already all put money through taxes towards, schools and roads and things that we all use and we all mutually benefit from. Like we would all mutually benefit from having health insurance and making sure everyone has access to that.
Okay. Is there any more rebuttals? No.
I don't think so.
Okay.
Unless
What did you guys think about what I was talking about with not free healthcare, but like a little bit, like kind of meeting halfway, almost like a little bit more regulation? Because I think it's pretty clear that there's definitely like some improvement to be done in the healthcare system here. So like, why wouldn't we just build off of what we already kind of have and just keep improving that instead of trying to do a whole new system? Sorry, I don't mean to, I just wanted to
No.
keep talking.
It's all good. I mean, I guess the only thing I would say is that I think it's easier just to start from scratch and build a whole new system than it is to try to fix. If you just start over and make it a free healthcare system, then I think it would be easier than to try to slightly change the system into making it a halfway system.
Okay.
I don't know. I feel like it'd be hard to just start over because you'd be changing what everybody's used to just something new out of nowhere.
I mean, I'm
I
not
mean,
saying
it
that
is-
this change would happen like right away. It would obviously take some time,
So you mean like
but
gradually shift over to it then rather than
yeah,
okay.
yeah.
I mean,
Not
it would
saying
be such a huge change either way that like it's going to be difficult no matter what. But there, I mean, there is definitely a huge difference between advocating for free healthcare versus just some sort of universal system.
and what you were saying about Preston about earlier, what if you don't need to see if having free healthcare makes an overall healthier population? So yeah, maybe eventually you don't need to go see the doctor after, maybe you don't need yearly checkups anymore. But with free healthcare, it would create that healthier population, so you wouldn't need to be seeing that doctor every year, maybe.
Well, if you're able to see a doctor for free, there's no reason, there's nothing discouraging you
Is
from
it
doing preventative
to?
care and making sure that you're going and
Yeah.
making sure nothing's wrong.
That's true. I didn't mention this earlier, but I read some other articles that would say like the opposite happens, right? Because everyone can go see a doctor, they're less likely to make healthy lifestyle decisions. If that makes sense, like there's no like incentive to not make a healthy choice if you can go see a doctor for free.
Okay. I mean, yeah.
Let's see what else. Oh, I think we already talked about this kind of, but like for a set standard of care, I mean, I just think it'd be so difficult. And I know you said like over time, like slowly. So would that be in like certain places that so would you start with reduced costs, you think, and then eventually work your way to free? Or like, would it be free like in certain places or at certain, yeah.
I think I would start it off as free in certain places in non like overly populated areas, and then make its way. So I wouldn't like start in like New York or Los Angeles or Miami. I'd start it in one of
Somewhere like
lower populated
Kansas or something.
cities. Yeah, I'd start in lower populated cities and then make its way up to the larger populated.
Mm-hmm. Do you think it would cause problems though if people are paying for other people's healthcare and then not even receiving the benefits for it?
For starting out?
Yeah, for like it being free in certain places and not others. Like other people are paying for it, but they're not even getting free healthcare.
The only thing I would say is they're eventually going to get the free health care, and maybe somewhere the government can compensate them, like, I don't know, like I'm gonna say a stimulus check, like later down to compensate for the money that they were paying while they didn't have the free healthcare yet. So
Well, in that situation, you could also, if it's confined to a certain state or a certain county or something, there's state and
Yes.
county taxes. So
Yeah, just make it state
if that
taxes.
cost could just be confined to that area as well.
that's true.
Okay. Yeah, that makes sense. Do you guys have any more? I don't think I have any more for you guys.
So, I mean, did anybody find like another way we could pay for it besides raising taxes? Like maybe we could cut funds somewhere else and throw them at healthcare, maybe.
I didn't find any like articles or anything about that, but personally,
sure
I
you
think
can
that
cut
cutting
funds
somewhere else.
from somewhere else. I know the largest portion of funds go to defense, so the country's defense, which the government probably isn't going to cut out of that. But I'm sure there's other funds that the government can cut from to add to the healthcare fund.
Mhm. Yeah, I was gonna say the defense budget, or like
It's like 3 trillion.
it's a lot. It's a lot. Yeah. Which, I mean, right now. But, and also I don't think people would want to, but I mean, it's a really obvious answer right there. Just don't know if it would actually, people would do it.
No, I don't think they would cut from the defense fund, but I'm sure they can cut from other funds. I don't know anything.
I don't either. That's what I was just asking.
I don't know any other funds besides the
Education.
defense fund, but
Education,
I'm sure that there's
yes.
other funds that the government can cut from. Yeah, sure.
Mhm. Yeah, I think
Eventually, the free healthcare would lower the cost, lower the economy cost. So, I mean, I guess you wouldn't be putting up with the high taxes for very long, I assume, from what I was reading.
Mhm.
Because I was reading it would lower overall
Lower.
living. So you
Hopefully.
would only be paying that high tax rate for so long. I don't know how long that tax rate. I didn't get to see that, but eventually you would not be paying that.
Yeah. Oh, I had something, but I don't know if this really goes with it of like, should we, but I don't like, could we? I just don't think that, like, I mean, I think I looked at the statistics, and technically in the US, there are more people pro universal healthcare, but like, I don't know how that would get passed in the government. Like, I just don't see it happening. Not that I'm saying that it
Like
couldn't, but like, I don't know if it will, kind of.
the bill getting passed through Congress and stuff, or something like that. I don't know how it works.
Yeah, I don't know if that really goes with like maybe it should be provided for free, but yeah. So I mean, I don't know if that really goes with like the difficulty of it. It's just something to add to the conversation.
Yeah, I mean, I guess that's a government thing for them to pass.
Mhm.
But I guess this would be assumed if it got passed.
Yeah.
Or didn't get passed in your guys' case.
Yeah.
That's.
Are we good on time?
I don't know, does it say the time, Preston?
No,
on your
I don't
thing?
see it. I don't see the
Wow.
time.
How long has it been?
Can't check. I pause recording. Do you think it'll tell me what time it is?
Maybe.
I know I sent in the chat my email at 4:44, which is
So it's probably been going on at least 20 minutes
right
then.
before you hit record. So it's going out for 20 minutes.
Okay. Around there.
Like 20, yeah. Like 25, I think, then.
Yeah. I think that's what he was looking for.
Something
Yeah.
like that. Is there anything
Yeah.
else anyone wants to add?
Nope. I think I'm good.
I think this was a good, oh, what is this? Oh, upgraded. I think this was a good discussion. That's what
Great
I'm
work.
saying.
No, I don't have anything else to add. So
I mean, I guess like final thoughts, like what do we all think after this discussion? Should we have universal healthcare or not?
I mean,
I mean,
I
I'm on the pro side, obviously, for this discussion, but in the United States, there's no way you could provide universal health care. I'm just gonna say that. Even though
Yeah,
I'm pro in
speaking
this
more-
discussion, it's impossible to provide universal health care in the United States.
not in America, no. I mean, I know I'm con, but I personally think it would be really like I think it'd be great to have universal health care. But yeah, I don't think it'll get passed. It would be pretty difficult, especially after doing this kind of research. But I mean, I was looking at more articles that were going to be not in support of it.
Yeah.
So that might be like mixing up a little bit. But yeah, I think me personally, I support it, but I was not arguing that.
The idea of universal health care is great, but I think
Yeah.
implementing it, especially in the United States, it would
Difficult.
just ruin everything. Ruin
Well,
the
we definitely make a
economy.
lot of changes.
Yeah.
Right. The discussion of like hypothetical improvements that could happen is very different than the discussion of how it would actually be
Yeah.
implemented, because I don't think that it could be the way that we run the country.
No.
Yeah.
Which sucks because obviously there's a lot of research backing having universal health care.
Right.
Yeah.
Universal healthcare is like step 5 in a whole, like all these other things have to happen first before we get there.
Mhm.
Like I struggled so much to find articles that were like scientific, that were against, like completely against free healthcare. So that's why I had to go to, oh, let's reduce the cost, because I literally couldn't find anything else that was actually like reliable that supported keeping everything the same.
Yeah.
All right. Well, let's see how long this video is then.
Should be like 25